On the 18th, I think, of last month, they phoned me, telling me my wife is not feeling well. They tried to feed her, but she's not eating. So what they're going to try is, they're going to try and get a bed for her at Joburg Gen. I think it was on the Tuesday. The sister phoned me, they said, no, they got a bed. A little while later, then the social worker phoned and told me my wife got COVID-19. That was the Tuesday. The Wednesday we phoned to ask about the progress. They didn't give us any feedback. So we tried again the following day. So they didn't give us feedback. My daughter was trying, she was phoning frantically all over the show. They were telling her telling her to go there, but we didn't get any response. And then when I got home, my daughter told me, no, Daddy, let's go and find out at the hospital. Why is there no response from the hospital? When we got there, they told us the social workers is still in a meeting, but they'll see us. We waited about for 15 minutes. After 15 minutes, they came out and they called us in a meeting. It was the hospital manager and a social worker, and I think it was another lady, I don't remember her name. So they said the reason why they couldn't get hold of us because they were sending a nurse to go and find out what is my wife's condition. But after the nurse came back, the nurse informed them that my wife passed away. So my daughter asked them, so now all this time, you didn't tell us my mother passed away. So why did you wait so long? So they said it was a communication problem at Joburg Gen. The lines was, I don't know what was the problem with the lines. So they said what they're going to do is they're going to give us my wife's ID to go and identify the body. On the Thursday we went to the mortuary to identify the body. I asked the undertaker, can you please indicate to me on what date my wife passed on? And he said, no, your wife passed on Monday because it was written there 22nd. So all this time they were communicating with me, my wife was already passed on.
It was very tragic because my mother wasn't the same. We didn't have that mother-daughter relationship anymore. I used to go to my mother for everything that happened in my life, and then she didn't respond the same to me anymore.
Her condition went from bad to worse because when she came home, she couldn't wash herself because my daughter was washing her, or sometimes Mia was washing her. She couldn't walk. They said she had dementia. She was sitting in a wheelchair. She survived, but I couldn't say she survived because she wasn't the same anymore.
When I found out that she passed on, it wasn't the same anymore. The moment I heard the news, it was like something inside me died as well. And until today that I can't, I'm still trying to figure everything out.
To me, they were very insensitive. For my wife to pass away and for them to keep silent since Monday up to Thursday. If we didn't go Thursday and confront them, then they wouldn't have told us at all because we don't know what would have happened. They just treated her like maybe a number.
It's like a number to them. It's not like a human that something happened to them, like it's my mother, it's my father's wife. It's not like that, it's just a number to them.
One of our patients, of course, as part of what has been happening, got sick, unfortunately was transferred to one of the state facilities, and then unfortunately demised at the state facility. So we were informed, I think, about 3 days later. Ordinarily, also, we should have been informed pretty much on the same day, that the patient passed away. So I think the challenges are that, firstly, you have got people who have long-standing mental health issues, and by virtue of that, during this time, because there's an additional, a stress burden on the entire kind of, set of communities. So people are are overwhelmed. So whether it's from a financial point of view or, things that are happening within their family, people are losing loved ones. So there's an escalating rate, of mental stress, pretty much on all of us. It's very difficult during this time because, of course, we cannot even engage the family members, in the care of the patients. As you know, hospitals have not been allowing visitors, since about middle of March. So that's also adding a lot of stress, and anxiety on the part of family members because their loved ones are in institutions and they can't even, access them. We are now, trying to find the ways, technological means, to make sure that family members can at least be able to interact, with their loved ones.